Hello, welcome back to my channel. I am going to be talking about how to find the right doctor for you, some green flags to look for, and some red flags to look for as well. I've been doing a health and wellness journey for a while now, so I definitely feel like I've gone through a lot of different doctors and a lot of different trial and errors with that, and so I would like to share kind of what I've experienced in the health world in the US. You know, I am not a doctor. What I'm going to share is really just my experience, and I'm also going to be sharing some blood work that I get yearly, but really I'm just going to be talking about what to look for when you're trying to find a doctor, because it is not always easy to find one that understands you and that can connect with you and that is supporting you in the right ways. I've been to a lot of different doctors, Western trained doctors, Chinese medicine doctors, holistic doctors, functional medicine doctors. So I've been to a lot of different ones, and I would say my favorite is a functional medicine doctor, because they really look at everything and try to get to the root cause of things. Holistic doctors do that as well, but sometimes their approach may be a little bit different than what you're used to or what you want. I would say that you need to be really clear on the things that you're dealing with, what symptoms you're having, what it is that you're looking for in a doctor, and seeing if they're the right match or not. Usually they'll have consultations that you can do on the phone or something, so you can talk to them first. Now, I don't know about all the Western trained doctors, but this is how it is for holistic and functional medicine doctors. I would say it depends on your insurance, but sometimes it is going to be out of pocket. For instance, when I was seeing my Chinese medicine doctor, that was all out of pocket, and she was doing acupuncture on me as well as giving me different herbs, and I worked with her pretty consistently for several months, and then I would still see her over several years, just not as frequently, which is kind of what you want. You kind of want to just see your doctor maybe a few times a year. It just depends on what kind of service they're providing. But I would say some red flags would be if they are dismissing your symptoms, or if they're not acknowledging what you're saying, or kind of acting like what you're saying is not true or can't be true. They are doctors and they are trained in a different way than the average person, obviously, but you really do know your body the best. And so if something's wrong and you feel like something's wrong, but all your lab work is coming back normal, odds are they may not be running the right test for you, or they're just not trained in the right way, and they can't see something that might be abnormal that a functional medicine doctor might look at and connect different dots, if that makes any sense. If they're dismissing how you're feeling, and if they're making you feel like you're kind of crazy, you need a new doctor. And you might have to try several different doctors, of course. I would say some other red flags are if you walk in and you just feel like they're not very present with you, and they're not really paying attention to you, they're not making eye contact, they're somewhere else. I don't think that they're the right doctor for you. You really need to feel like it's a one-on-one consultation, you are their only patient right then, they're not thinking about anything else. That's just from my experience. I really want to feel seen, and I want to feel like I'm getting my money's worth when I'm visiting them in person and online. I would also say if they're not willing to give you other recommendations or other resources, that might be a little bit of a red flag. Say that you're interested in learning more about candida overgrowth, they're maybe unsure about candida overgrowth in general, or they just don't know who to suggest you to go to. I would say just go to someone else who would be more knowledgeable in that. If your doctor isn't asking you about your diet and your lifestyle, then that's also a red flag, because a lot of the times Western trained doctors, they hardly take any kind of nutrition course, and nutrition is the foundation of our health, among other things. Of course, what you put in your body, what you're eating, it's gonna be something that they should definitely be asking, especially if you have reoccurring symptoms like yeast infection, bloating, headaches. Really everything can be linked back to what you're eating. They need to be asking questions like that. You will have to fill out a really long form at the beginning. I know that those are usually a pain, especially if you've gone to a lot of different doctors, but that paperwork is really there for them to be able to go over and understand what you're going through and what your symptoms are. The green flags are obviously kind of the opposite of that. You know, you feel like you're being seen, you feel like you're being heard and understood, and they're willing to work on you, they're giving you resources, they're communicating well, they're calling you back, they're willing to run different blood work panels. And honestly, I am definitely not one to suggest what kind of blood work that you should do. I would say, you know, whatever kind of vitamin and mineral testing that they do. Obviously, they'll do like a complete blood count, which tests for your red and white blood cells. That's kind of like a standard. If you want a more extensive lab testing, I think you would have to suggest, like, I want specific vitamins and minerals tested, like vitamin D, vitamin B, B12, anything specific. So you might have to do a little bit of research to see what it is that you might need to be tested in. Ideally, the doctor should be able to understand what your symptoms are and run those tests for you. That's why I think it's so important to find a doctor that you trust, is because you can really just say, hey, here are my symptoms, this is what I'm dealing with, what can we test in my blood to see where my deficiencies are, see where I might need a supplement and what I need to change. They should be the one that has the knowledge for that, and you shouldn't necessarily need to do a bunch of research, but knowledge is power, and I suggest you do that anyways. For the blood work, I would say complete blood count, a basic metabolic panel. That's gonna be like your glucose, your sodium, your potassium. You could also do a thyroid panel. This will test your T3, T4, and your TSH. The complete thyroid panel might be really beneficial if you think that you're experiencing some hormone imbalances. I think for the vitamin blood test, it's like a comprehensive vitamin blood panel maybe. Honestly, I'm not 100% sure on that, but I think if you just ask your doctor that that's something that you would want, and see if your insurance can cover that, see if they have any knowledge for that, and make sure that they send it to the lab that your insurance covers. So for me, it's either like LabCorp or LabQuest, I think, but it's different. There's tons of different labs everywhere. You could always call your insurance as well and see what lab they suggest. And if you're curious to know what kind of testing I did for Candida overgrowth, I did do a Candida albicans blood analysis. I don't know if that's exactly what it was called, but my holistic doctor did that. You can also ask if they can order a GI map test for you, and they can order it and send it to your house. And this is basically a stool test that you'll do, and you'll send it back and it'll analyze what's in your stool. And you can also test for Candida overgrowth. And you can also do a zonulin add-on. If you're interested in knowing if you have leaky gut or not, zonulin is a marker that indicates if you have leaky gut or not, and hopefully they'll have the resources to give that to you. But yeah, I know that a lot of times it's really frustrating because you have all this stuff going wrong with you, and it's expensive to go to the doctor as it is. Maybe insurance doesn't cover it, and so it's really frustrating to try a bunch of different doctors. But I promise you, when you do get to that one doctor that believes in you and makes you feel understood, it's gonna be worth it. But I would say going the more holistic route and searching for like functional medicine doctors, that's what I did. And that's where I found the best doctors, is searching for doctors that were trained in that way. A lot of the times, like the typical Western trained doctor is not going to be able to connect the dots like the functional medicine doctor or the holistic doctor is, and their approach is going to be very different too. So keep that in mind. And I just want to encourage you to do your own research too. Like, I am still learning so much, especially about like blood work and what to ask for, and I am just really trusting my doctor when she comes back and, you know, gives me the answers and tells me that maybe we should do more testing on this or this. But it is so important to do your own research, and it's overwhelming, of course. I started doing this holistic health journey in 2019, and I'm still learning so much, and it's 2024. But I do understand some red flags that I look for now in doctors. You know, always trust your gut. Like, if you feel like you're going down the wrong path and you feel like it's not the best fit, then you can just try a different doctor and try a different test, you know, or maybe just get a second opinion. Like, hey, I got this blood work done. You can take it to another person and see if they can have a different approach or see if they see something different, you know. Always keep a record of your blood work. Whatever kind of test you run, always keep a record of those, because that's something that you can show your doctor, your new doctor too, is like your history of, hey, this is my blood work at this time last year. This is my blood work at this time at the beginning of the year. This is my stool analysis last year. You know, you can show them all these things. But yeah, I try to get my blood work done at least once or twice a year. If I'm working on something specific, like right now I'm working on my thyroid, it's something that I am gonna be testing every 3 months, just to see if the new supplement that I'm taking is working or not. So sometimes you might have to go in more frequently. I also want to mention that maybe you should be looking for a nutritionist or a health coach, because working with a nutritionist or a health coach for me personally has made the biggest impact in my health, because you really get that one-on-one experience for however many months that you're working together, whereas a doctor, you'll just see them a few times a month. So it may be a little bit more expensive to work with a nutritionist or a health coach, but honestly it's so worth it, and they'll give you so much knowledge that you can take with you for life. Whereas a doctor, I just kind of use them now as someone that I can get my blood work done. They can tell me what kind of supplements I need. But if I really want like a protocol or some guidance through a cleanse or something, that's when I would turn to a nutritionist and a health coach. And also a nutritionist sometimes can order stool testing for you, which I think is so important. I know I mentioned that earlier. Stool testing is awesome. But yeah, I just want to mention that working with a nutritionist or a health coach may be even more helpful for you than working with a doctor. Doctors, I mean, obviously are trained very heavily and differently than a nutritionist and a health coach. But I would just say overall, finding someone that you trust is gonna be the most important thing. I'm not an expert in this, but I'm just gonna share what I've learned and my journey with trying to find the right doctor for me. But I hope these tips really helped you. Give it a like if you liked it. Let me know if you want anything more specific in the comments down below, and I'll try to do a video for you. But yeah, I hope that you enjoyed this video, and I'll see you in the next one. Bye.